Some of the rewards that I also get from being a doctor is that I actually get the joy of seeing them in less pain after one visit sometimes, even if it means either I do an injection or something small of like maybe even debriding a callus that's been bothering them for the past couple of years. That joy and happiness they say that the amount of relief that they get is one of the things that kind of drives me in and gives me a big reward of being a podiatrist. Some of the advantages that that I see, especially practicing in a smaller community, is that I can actually do the entire scope of podiatry, whether it encompasses any sort of trauma, reconstructive work. I enjoy all aspects of podiatry, and I am actually very excited to be that person that people can come for my field of expertise. The biggest thing is the connection aspect. I know as I was in residency in a bigger hospital system, I wasn't able to give the time and effort to actually learn about my patients. Adams helps me kind of engage with the patient actively and listen to them and understand where their problems came from. And due to that time and effort, I can get to know them very well in my practice. The reason why I chose podiatric medicine was actually I used to be a runner in cross country and track in college, and I actually had a whole host of injuries that most of the athletic trainers couldn't really focus on, so they had to actually send me to a specialist. And that specialist was a podiatrist in the actual community. And when I got there, he actually did a whole host of things that actually helped me run my best season ever. The connection between sports medicine and podiatry is that a lot of people kind of go and struggle with ligament injuries, ankle sprains, any sort of high ankle sprains. Those are the sports medicine injuries, especially with people that play football, running, or soccer. I kind of go hand in hand. And one thing that I can do as a podiatrist is actually give different rehabilitation products, and that's what I want to drive through with my practice. Is kind of doing the same thing that the podiatrist did for me, is to make sure I actually do my best in the best season that you can that I can give them. Some of the procedures that I do really do entail the entire aspect of the foot and the ankle. I definitely do bunions, hammer toes. I also do any sort of forefoot deformities, especially correction of them. The next, kind of going off to the midfoot, I could definitely treat a lot of arthritis in those regions, especially if it needs to be in the fact of me fusing specific joints to ensure that they have more mobility or functional mobility. I even also do diabetic foot care, which also then leads to limb salvage. The next thing with limb salvage, I do a lot of heavy reconstructive work, whether it is flat foot for pediatrics, flat foot for adults, any sort of neurological conditions, and have done a lot of nerve procedures which are related to diabetic peripheral neuropathy. Reconstructive work, especially with the rear foot and the hind foot, and I do a lot of trauma, whether it is any sort of metatarsal fracture, anything that's kind of come up with any sort of forklift injuries, any sort of open fractures, you name it. I definitely, from my residency, I've done a lot of trauma and reconstructive work. Some of the reactions are actually just a basic smile. The smile is what kind of drives me, especially just even if it's a matter of doing my bread and butter, especially with diabetic foot evaluations, people having trouble with calluses or cores. Honestly, anything that I can do that can be an easy fix in the office, the biggest thing I see is a smile.